What's good, Dr. Squad? Dr. Traitline here coming at you with another episode, this day from Binghamton, New York. Today, we're going to talk about COVID, and we're going to answer some commonly asked questions that we got through the internet and through interacting with patients and people on the streets, and we're going to see where this takes us. So, with no further ado, let's get to it. If I'm pregnant, can I give COVID to my baby? The short answer is no. While you're pregnant, there's still no evidence whatsoever that you can actually pass the coronavirus through the placenta to your baby while you're pregnant. So even if you unfortunately get sick, your baby is safe while you're pregnant. However, if you happen to be sick while you deliver, then your baby is at risk once the baby's born. So your medical staff are going to take precautions to try and help prevent your baby from getting sick after the fact. Unfortunately, that's going to involve isolation. So they're going to keep your baby away from you so that you can't expose the baby to the SARS-CoV virus so that the baby doesn't get sick. But while you're pregnant, no, you're totally safe. Can my husband come with me to the hospital for delivery? What about my family? Yes, you are allowed to have one support person with you in labor pretty much everywhere. I'm not aware of any areas at this point that are saying absolutely nobody. There was a short time about a month ago where there was a large outbreak in an area, and that hospital or several hospitals in the region limited to 0 the number of support people for labor patients, but that's since been rescinded and deemed a little bit too over the top and too overkill. However, your family will not be permitted in the hospital. We don't want to have undue people getting exposed for no apparent reason, and it's safer for them to see your baby by pictures and by internet, unfortunately, until after this crisis is over. But if they show up to the hospital, they're going to be denied entry. I just had a baby recently. Congratulations! Why did all the staff put on additional stuff when I started pushing? Well, what they were doing is that they were trying to protect themselves from what we call the second stage of labor, which is when you're pushing. And the thought is, when you're pushing, you're working so much harder that you're at a much higher risk for aerosolizing potential viral particles. So when you're just laboring normal, you're breathing, but you're not aerosolizing. You're not making it into like a mist that's more readily gets through the masks that they're wearing. So when you start to push and you're working very hard, and you might be doing one of these, you bring in that big breath, you hold it, and you go to push, and you spray out some stuff, and that's aerosolization. And if you happen to have COVID, then you're actually increasing the risk for staff. So some institutions, not all, but some are wearing the N95s like you see on the news and hear about, and then they have more chance of prevention from an aerosolized risk. You'll also see that during surgeries. Anesthesia and the staff will wear all that stuff while they're intubating a patient because the same risk exists. If we test positive for antibodies, are we safe? Well, the short answer is that's not determined yet. There is generally good data that prior exposure to a virus will cause antibody formation, which will be protective for the next exposure to that virus. However, COVID is too new and not studied well enough to truly know that yet. So while we think it's likely, we can't actually definitively say that that's the case. So the answer is stay tuned. Do you believe it's as contagious as they say it is? Yes. I have no reason not to believe what the CDC is telling me about this and all the research that they've done. Most of this is bared out by research and scientists and people doing a whole lot of work and looking at a whole lot of studies and epidemiology and data and coming up with all the recommendations. But consider the spread, how it's gone from one location to around the globe in what is relatively a short period of time. And without doubt, that tells me it's extremely contagious. Can my pets get it and give it to me? Well, yeah, that was on the news a little while ago. A random tiger, I think, or a lion or something in a zoo got it. And I think a house cat got it and was proven. But no, there is zero data and evidence to support that your pets can actually transmit it to a human, you, even if they got it. Odds on favorite, they'll never get it anyway, but there is no proof or suggestion that it's a risk at all. So you're safe from your pets. When will we have a vaccine? That's a wonderful question. That would save so much lives, all the economic destruction, the shutdowns. If we had a vaccine that was proven effective and lowered the numbers to something completely manageable and reasonable, then we would be done. Everything would be good to go. So vaccine search and testing is critical, and it's actually happening as we speak at what is essentially a lightning fast pace. We never really go this quickly when it comes to vaccine research. Usually it takes years to develop. They test, retest, prove that things work, prove that they're safe with animal models. Then they start to slowly build up with some human testing to prove that it's safe. And then ultimately they prove that it's effective. In this instance, they're trying to prove it's effective and speed up that whole process, because more delay is going to actually cost lives and cost the economy and everything else that we're experiencing. So they are indeed doing the best they can to ramp this up as quickly as they can. In fact, in my region, Rochester, there is an active vaccine trial just getting underway out of Rochester General Hospital, and there are, I think, 7 or 8 others around the world that are coinciding and happening on their own. And it's basically a race to see who can find this first. Yes, you can say money, and whoever finds it first wants to because they'll be rich. Yes, they probably will, but at the same time, they'll also be, a hero to society, because the good side of it is that they'll save lives if they find a valid vaccine. So they're actively working on it as we speak, and hopefully they'll find one soon. It is not going to be next week. Soon is going to be months from now at best. Probably beyond Christmas is a more reasonable estimate, as the soonest possible, most optimistic goal that you can imagine. It's probably going to be longer than that, just in reality. Does it help to wear gloves while shopping? No, it definitely doesn't. All you're doing basically is cross-contaminating everything to everything else you touch. So when you wear gloves, you're wearing gloves essentially to protect yourself from a contamination. So I get the thought, I'm going to protect myself from being contaminated by wearing the gloves, and then when I touch things, I'm not going to actually touch anything, so I should be all set. Except that you're touching everything with those same gloves the whole time. So you pick up a box of cereal, you put it in your cart. Someone else already touched that box of cereal. You now touch the next thing with your gloves, so you spread it to the next thing. You're not actually cleaning anything, you're just shifting things around and cross-contaminating. So, in a nutshell, no, that's not helpful at all. Does washing my hands kill the virus? The short answer, no. Washing, cleaning does not kill viruses, germs, bacteria. Washing and cleaning decrease the viral load, the bacterial load, the absolute number of viral particles on your hands. So when you decrease the number to something extremely minimal, you thus decrease your chances of transmitting whatever was on your hands into your body. So hand washing drops the number of viral particles so low that even if you were to, after washing your hands, inadvertently rub your eye, you're no longer as likely by far to get sick. Disinfecting, on the other hand, is when you actually do start killing things. And that's when you're using cleaning products like bleach, Lysol, Clorox wipes, things like that. And you're using those on inanimate surfaces like countertops and stuff. And that is killing bacteria. Best example for everyday use, chicken. You cut chicken breast and you get some dripped off the cutting board onto your counter a little bit. You use a disinfectant because there's bacteria on there that you don't want to have linger and live. So that's the short story on that. So that's all I have for you today. Leave a comment below. Ask any other questions you might have that I didn't talk about. I'm happy to try and answer everything I can. If you like the video, throw us a little like in the corner. It helps with the channel. It helps build up the viewership, as well as subscribe, just like every other YouTube video tells you. Like, subscribe, hit the notification bell, and we'll see you next time.